This is a case of a 57-year-old female complaining of about 6 months of pain in her right Achilles tendon. She's a runner and very active and has really been unable to perform at the same level that she would like. Also, she has discomfort with walking as well for any prolonged period. Initially, we treated her with acupuncture, which took away some of her pain, but not all of her pain. We then went ahead and did a platelet-rich plasma injection using ultrasound guidance. During this procedure, you can see that she has a linear intrasubstance tear at the insertion of the Achilles tendon, as well as a small amount of linear calcification distally in the tendon as well. Besides doing the platelet-rich plasma injection, we used ultrasound to guide the needle and do a fenestration of the distal tendon, and then we injected her with platelet-rich plasma. So here's a gross depiction of the procedure that we're going to perform. The needle is going from a proximal to distal direction in line with the Achilles tendon fibers. And here we are starting our needle fenestration or needle tenotomy of the distal Achilles tendon as a way to try to elicit healing mechanically. And also this needle fenestration can elicit bleeding, which can help healing as well. Now we're starting the platelet-rich plasma injection, and we basically are just injecting the distal part of this Achilles tendon that has this calcification and partial tear. And here you can see a close-up view of the needle relative to the probe. So here we are looking at the lower extremity. We can see the small saphenous vein going distally, and also the Achilles tendon. See the Kager's fat pad underneath that. We're rotating medially now, and we can see the tendons on the medial ankle, tibialis posterior, flexor digitorum longus, and the flexor hallucis longus tendon as well. And now we're rotating again laterally. And again, you can see Kager's fat pad labeled here. I can also see the lateral aspect of the Achilles tendon. And here's a gross depiction of this lady's Achilles tendon. You can see how it's thickened and erythematous at its distal aspect. And now we're zooming in. And again, you can see the Kager's fat pad and the tibialis posterior, flexor hallucis longus, and flexor digitorum longus tendons medially. The tendons, however, are cut off and not complete in this case. And here we are, we're zooming out, and we can get a sense of the distal Achilles tendon as it's somewhat bulbous in shape, again consistent with tendinosis. She also has an intrasubstance tear in the distal Achilles tendon, which you cannot appreciate here. Now the superficial aspect of the Achilles tendon is made transparent, so we can see this calcification that is also in her distal Achilles tendon. And we're bringing the lower extremity into position for the procedure. And here's our probe and our syringe. And initially we're going to do a ultrasound guided needle tenotomy / fenestration, and also try to break up that calcific density as well with the needle. See the needles essentially going into and out of the tendon and this calcific density as well. Here we are changing direction of the needle. Try to cover as much territory as possible through one needle stick. And we're going into the calcific density itself. And also appreciate the plantaris tendon on the medial aspect of the Achilles tendon. And here we are, we're zooming in, and we're going to initiate the platelet-rich plasma injection. You can see the platelet-rich plasma being injected into the distal Achilles tendon. The 7-year-old female, right Achilles tendinosis going on for about 6 months. Does that sound right?
Yeah.
She got some partial relief from acupuncture treatment, still having discomfort really at the insertion. Negative Thompson sign on exam, and just tendon palpation again right at the insertion. It's kind of diffusely at the insertion, both medially and laterally. We're going to go ahead and do a platelet-rich plasma injection today and a needle tenotomy / fenestration of her tendon. You know what? Let's okay.
So that was it? I mean, one.
It's the first time you gave PRP, a second.
First?
Do me a favor, just point your toe like that way.
Which toe, which way?
Just like that. You see like that? Keep your foot like that, okay? Michael? clip.
Yeah.
Here's our first clip. We're just going to try to go and kind of break up the calcium a little bit. And here you can see the thickened Achilles tendon as it approaches the calcaneus that's highlighted in yellow. And also there is a small little intrasubstance tear and a little calcification distally as well. You clip that?
I did.
I'm going to go a little bit medially on our second clip. Third clip, we're doing an axial view clip. Left side of the screen is lateral, right it's medial. And you can see my needle on the bottom.
Okay.
So it's good to use your axial view just to kind of figure out where you are medially and laterally. Also, we're going in and out of that intrasubstance tear. You can see that on the axial view to try to stimulate healing. So that's our tenotomy. We're at long axis view or sagittal view. And here we are, we're basically trying to get right near to the calcaneus. Going right to our calcaneus, essentially. You're doing very well. You okay?
Okay.
Alright, now you're going to feel some pressure. We're going to inject with some PRP now. We're going to do on top of the tendon. So here's all that bright signal, which is essentially your PRP filling up that distal Achilles tendon. And also that intrasubstance tear also becomes more apparent as you inject PRP into it.
Oh, no.
Almost done.
Mm-hmm.
I'm trying to get it to where it really kind of hurts you. So we're about 3 weeks into a PRP injection, and how are things going?
Better, but when can I start at least bicycling? I don't have this feeling of being thrown back when I go to work. It's like constantly getting better, but it's still there.
How much better? How much percentage of your pain you think is gone now at this point? I mean, it was
The pain is actually it's more or less gone. Maybe it's even a mental thing.
And how does it feel when you run?
Good.
So you're not having any pain?
No. I'm not doing the full 5K, not yet. I'm not doing hills. I'm not doing speed. Just running. I'm not going to say 100%. It's 95 or 97%, which is good because